Hi, my name is David Rosenblum. I'm the Director of Pain Management at Maimonides Medical Center and AABP Integrative Pain Care with multiple locations in New York City. I practice out of Great Neck, New York and Brooklyn, New York, and today I want to talk about epidural steroid injections. Epidural steroid injections are used to treat pain related to nerve impingements or inflammation of the nerve related to a disc herniation or pathology that can cause inflammation of a nerve root leaving the spine. It's treating the pain in the back or neck or mid-back that radiates usually towards the extremities or somewhere else. Injections are generally safe. There are, of course, some risk involved, infection, bleeding, nerve damage, but typically most patients do quite well. It may take 3 to 7 days until the steroid kicks in and relieves the pain. The epidural space is a space surrounding the thecal space. The thecal space is a sock-like space filled with fluid and your spinal nerves. The epidural space would be a space between the walls of that sock and, if you can imagine, another sock enveloping the first sock. It's an empty space, more or less. There are blood vessels and fat there, but it's actually a space with a negative pressure. And when us anesthesiologists or pain physicians put a needle there, we can verify our location based on the way it feels, as well as by shooting some contrast under X-ray guidance, and that helps us guide the needle to the proper location. Once in that location, we'll deposit a steroid. So when patients come in and they say, I need a cortisone shot, well, cortisone is a drug, or it's a term usually referring to a steroid drug like depomedrol or triamcinolone. And the epidural is not really a drug, it's a place. So one needs to understand that the cortisone shot could mean anything. It could mean a muscle injection, a joint injection. An epidural shot is generally with a steroid when treating pain. Some people are using biologics such as PRP to reduce inflammation and promote growth of healthy tissue in that region, or at least healing, not so much growth, but healing of the tissue. But the steroid is more or less the standard of care, and that's been going on for years. Although it's, as last I checked, it's not FDA approved, but it is something that is performed all day, every day in this country and around the world. So epidurals are typically quite safe when it comes to treating pain related to the disc or the disc impinging on the nerve. And generally speaking, patients will require anywhere from 1 to 3 epidural steroid injections to get pain under control. Every now and then, a patient may need more than 3 injections, and there's different approaches. You can do an epidural injection from the center, from the side, which we call a transforaminal injection, or from the caudal region. The caudal is by the tailbone, and many patients will need the different types of epidurals based on what their pain problem is or based on whether or not they had a surgical history. So if you're interested in learning more or having a consultation in person, feel free to make an appointment at aabppain.com or just call 718-436-7246 for my Brooklyn office or 516-482-7246 for my Great Neck office. Thank you and take care.